Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is BC's COVID-19 briefing for today, Thursday, June the 25th. Honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Friday, we'll be presenting a written report at 3 o'clock. And Dr. Henry and Dr. McDonald, I think, will be presenting tomorrow morning on some statistics and some background on Indigenous issues and COVID-19. On Monday at 3 o'clock, we'll be presenting another briefing here live in Victoria. On Tuesday, there'll be a written briefing. Canada Day will be off, and then Thursday, there'll be a briefing with Dr. Henry and myself in Vancouver, so that's next week. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. So for our update today, we have 19 new cases who have tested positive for COVID-19 and one epidemiologic linked case, giving us 20 new cases in the province today, bringing our total to 2,869 people who have COVID-19 in BC. Of that, 970 people are in the Vancouver Coastal Health Region, 1,504 are in the Fraser Health Region, 131 people are on the Vancouver Island Health Region, 199 people are in the Interior Health Region, and 65 people are in the Northern Health Region. We have no new healthcare outbreaks, and we continue to have 7 active outbreaks, 6 in long-term care and 1 acute care. We have an increase of 3 residents and 1 staff person in those healthcare outbreaks, bringing our total to 379 residents and 229 healthcare workers who've been affected. We also continue to monitor and support the 2 remaining community outbreaks, although no new cases have been reported in those today. We have 179 active cases in the province now, of whom 15 people are in hospital and 7 in critical care or ICU. Unfortunately, we've had an additional 2 people who have died from COVID-19 in the last day, both of whom were residents of long-term care, one in Fraser Health and one in Vancouver Coastal. And our condolences go to the families of these people, to their care providers, and to their communities. We have 2,517 people who are now fully recovered from COVID-19. So of the new cases announced today, 1 person was a teacher at a public school in the Fraser Health Region. All of the close contacts of that person have been notified by public health teams, and none of the students are exposed from that case. As you know, we anticipated and planned for this potential when we returned to some in-classroom teaching over the last month here in BC. And we've been monitoring the situation very closely along with all of the school districts and the Ministry of Education, and we've moved quickly when cases have been identified. And this, as you know, is our second that have been identified associated with the school. Today is, of course, as well, the last day of in-class learning for this school year, and students and teachers right across the province have really done an amazing job of adapting to a new way of learning that has been a trial by fire for everybody. It hasn't always been easy for everybody, particularly for students, for parents, for teachers, for administrators. And I really just want to commend everybody for persevering, for working together, to making in-class teaching in this past weeks, both possible and safe. And in-class learning is, we know, so important for some students. We've learned a lot, and those lessons will be applied as we prepare for the full return of school, however that will look like in September. And I know there's a group now who are taking the learnings from the last month to be able to come up with contingency plans for what school will look like for students across the board come the fall. To all of those students who are finishing the school year today, congratulations. You've made it through one of the most challenging years I'm sure any of us will ever remember. Have a wonderful summer, and remember to be safe. Yesterday as well, the Premier and I announced that we are ready to get underway with our transition, or to increase our transition into the next phase of our restart plan. This means more parts of our economy, such as the film industry, hotels, spas, can reopen with safety measures and precautions in place. Many businesses that have remained closed will also be reopening their offices as we transition in this phase. This has been a gradual increase, and I continue to believe that that is what we need to do. This is an exciting time in many ways because it has shown that we've been able to find our balance here in BC. Our balance of being able to increase our contacts measured and thoughtfully, as well as keeping our case numbers low and manageable. We know that as we have more contacts, as more stores, as more businesses, as more things open, as we travel more, we are going to have more cases. And what we need to do is make sure we have those measures in place that we can stop the transmission quickly and rapidly and make sure it's not spread to large numbers of people. We can take confidence in knowing we have established those clear foundations, and we've shown that over the last few months for a safe path ahead. These are the foundations that will carry us forward for the remainder of the summer, into next year, to the time where we have an effective treatment or vaccine for COVID-19. For all of us in BC, and perhaps for anybody visiting from another province, we need to continue to use our layers of protection, because that is what will keep us being able to manage in our society. So always staying home when we're ill, even if it's a mild illness. Our mantra of fewer faces and bigger spaces, small numbers of people, so that if we do inadvertently bring it into our circle, into our connections, we can manage those quickly and efficiently. Barriers like the plexiglass that we're seeing in many retail stores, in hotels, in restaurants, and one-way pathways that mean that we minimize those chances of having close contact over time. Making sure we continue to wash our hands regularly, cleaning more those high-touch environments to make sure that we reduce the risk of contacting the virus. Maintaining our safe physical distance, particularly from people who are outside our small circle, our bubble, is important. And using a non-medical mask when distancing is challenging are the things that we will need to continue to do. These are the foundations that will allow us to increase our social interactions and stay at that important balance that we have found here in BC. As we have been doing, we can all move at our own pace and based on our own risk and the risks of those we have in our families and our communities. Some individuals may choose to continue to limit their social interactions because of knowing that they have people in their social connections who are at risk of having severe illness from COVID-19. And some communities may decide that they are not yet ready to receive visitors. We need to be respectful of that. As we go through our day, it is important to be respectful of all of those around us. You have to do what is right for you, and what you do makes a difference. Makes a difference for your family, makes a difference for your community. Your decisions around where you go and who you may see have an impact. We are all connected, as we have seen in ways that we probably never imagined before. And just as we have worked together to flatten our curve and find that balance, we must continue to stand by and support each other in the weeks and months ahead. So let's do our part by staying 100% committed to protecting our families, our communities, and our province. And let's do that as we have been, by being kind, be calm, and being safe.
Thank you very much, Dr. Henry, and I want to join Dr. Henry first of all, and on behalf of the Premier, in expressing our condolences to the two people who have passed away in BC from COVID-19 in the last day, both of them in long-term care. We know how difficult it is in these times. It really is difficult for everybody in long-term care in these times to be living through this period of COVID-19, and I know that the sorrow and the grief people have felt about their loved ones in these cases are profound. And so we want to make sure that everyone understands that we feel their sorrow as well. I want to pass on all our condolences and best wishes to the families in what is unquestionably a very difficult time. I wanted to note there are, again, today 15 cases of people with COVID-19 that are hospitalized. That's 9 in Fraser Health, 6 in Vancouver Coastal Health, and of course nobody in the other 3 health authorities. That's up 1 from yesterday, and 7 people in critical care, as Dr. Henry has said. We had in our emergency room visits the last couple of days continued to be at a high point since the beginning of the pandemic period. Since the beginning of March, we had 5,613 people at our emergency rooms today, and that's a very significant fact that people have returned in those numbers to emergency rooms in BC. I wanted to say just a couple of things about surgery, which we're reporting on every Thursday. As all of you know, on March 16th, we postponed all non-urgent scheduled surgeries while continuing to provide urgent scheduled surgeries and emergency surgeries. From March 16th to May 17th, we completed 23,536 such surgeries, an average of approximately 2,600 surgeries per week. Prior to COVID-19, on average, we performed approximately 6,000 surgeries per week in the healthcare system. On May 18th, we resumed non-urgent scheduled surgeries, delivering them as well as continuing to perform urgent and emergency surgery. This action allowed us to begin the effort to catch up the approximately 30,000 surgeries that were postponed or not scheduled. This in addition to the scheduled surgeries that health authorities regularly complete to meet demand. The priority of this first phase of surgery renewal is urgent surgeries, surgeries with waiting times of less than 4 weeks, patients who have had their surgeries postponed, and patients who have waited more than twice their clinical benchmarks. We're also focused on patients whose surgeries can safely be conducted as day procedures and outside of the main operating room. 28,247 surgeries were completed since surgeries restarted on May 18th. Of those 28,247 surgeries, 21,461 were scheduled surgeries, and 6,786 were unscheduled or emergency surgeries. And just to give it to you by health authority, that's 5,231 in Interior Health in that period, 8,141 in Fraser Health, 6,092 in Vancouver Coastal Health, 6,211 in Vancouver Island Health, 1,427 in Northern Health, and 1,145 in the Provincial Health Services Authority. Each week I provide you with an interim report on our progress, and monthly reports, as noted, will be beginning in mid-July. Before I speak to how many surgeries were completed this week, I'd like to update you on last week's numbers. Last week I reported 6,291 surgeries were completed, which is great news. As we have implemented weekly reporting, there are some minor data adjustments made each week, and as a result, I can tell you that that number has actually been revised upwards and is in fact 6,425 surgeries were completed last week. That's the week of June 8th to 14th. This week we're reporting 6,358 surgeries were completed, and of those, 5,990 were scheduled surgeries, 1,268 were unscheduled surgeries. I note that the number of scheduled surgeries continues to rise by 40 from the week of June 8th to 14th. Number of unscheduled surgeries this week was down slightly. This obviously demonstrates the extraordinary work happening throughout the public healthcare system, and we are immensely grateful to everyone involved in this process to have arrived at this point and to be consistently doing 6,000 plus surgeries 3 weeks in a row demonstrates the commitment of all those involved. I just want to say finally that yesterday, of course, we entered phase 3 of our COVID response, and that announcement was made by the Premier and by Dr. Henry. I want to say that I think something that's said many times, and we've said many times, that physical distancing saves lives, that in fact what happens in phase 3, as we all do more things out in the world together, we have to be more vigilant about physical distancing in these times. It is much easier when one is spending most of the time at home to stay isolated from other people. As we go out in the world, we have to be more conscious of physical distancing, more conscious of not going out in the world if we're not feeling well, more conscious of washing our hands, more conscious of not touching our face, more conscious of all of the things that stop transmission, because we know when we're not conscious, that has consequences for everyone. We are in British Columbia in a world situation which has not been, in the last 2 weeks, very positive for COVID-19. Today we saw a record day of new cases in the United States, which is the country in the world closest to us. We've had state records in Texas today, 5,200. Nevada this week, 452. Florida today, 5,511. Arizona this week, 3,779. California this week, 6,712. Records in Oregon this week, 278. And of course, ongoing and increasing cases in Washington State that are of significant concern. What that means is that we, of course, are hoping all the best for our American friends. But this is the situation, these are the places in the world outside of Canada that we're closest to, that we visit most frequently. And they tell us why we have to continue to do what we're doing. That as we approach and open up things in BC and do more together and open up our economy more, that we have to be more vigilant, because it is in our interest to do so, and it is in, maybe just as importantly, in the interest of those that we love and in those that we don't know that we do so. So what I'm asking again, since we won't be holding a briefing tomorrow, is just to say that this weekend, let us recommit to being 100% all in this new phase of COVID-19 BC, understanding that people around the world are struggling with this. And what we should see from that is not to compare ourselves with them, but to understand what we need to continue to do to succeed in British Columbia. And I wanted to express my appreciation to everyone in the province for their continued commitment. Aujourd'hui, nous annonçons 20 nouveaux cas qui ont testé positifs pour COVID-19, pour un total de 2869 cas en Colombie-Britannique. Il y a eu 2 nouveaux décès liés au COVID-19, un dans la région de santé de Fraser et un autre à Vancouver Coastal, pour un total de 173 décès en Colombie-Britannique. Nous offrons nos condoléances aux familles et à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 15 personnes sont actuellement hospitalisées, dont 7 en soins intensifs. À ce jour, 2517 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Thank you very much. Merci beaucoup. We're happy to take your questions.
Thank you, Minister. For everybody on the phone, please press *1 to enter the queue. Please press *1 again, even though you've entered the queue. Please unmute your phones. You will not be audible until we call your name. And you get 1 question and 1 follow-up today. First question's from Richard Zussman, Global News.
Dr. Henry, I'd like to ask you about what happened in conversations between provincial health officers and the NHL. Was there anything that concerned you that led to the NHL looking elsewhere from Vancouver in terms of hub cities?
You know what? I've not had direct conversations with the NHL, and I've heard that today too. I haven't heard it for sure, but I understand that there was some questioning. What we provided was our advice and our basically the fact that we would take the health of the players and the health of our province as the primary concern in terms of having the NHL play in Vancouver. I actually think that that is a positive for us, and that it should have been something that the NHL saw as a positive partnership. We are doing very well. We have a good balance, but under no circumstances was I going to compromise in any way the health of people here in British Columbia, and we made that very clear. We also made it very clear that we were absolutely willing to partner with the NHL to make sure the health of the players and the people that were here in British Columbia during that, if Vancouver was a hub city, would be paramount as well.
Richard, do you have a follow-up?
I do. Can I ask you as well about schools? You mentioned that we have one additional case linked to a school, and you also mentioned, I think, that there's a working group of some sort that's been organized for September. Is there any early advice that you're providing around guidance for what preparation should go into a return to school in September?
Yeah, so my office is involved. It's been pulled together through the Ministry of Education, and it includes representation from the school districts, from families, and it really is to take a good look at the things that were working, things that weren't working. It became very clear that you know, some of the things that we thought would work well were challenging in certain grades, and that we'll have to think through how that looks. And we'll be looking at several different scenarios. So whether it's everybody back in class all the time, and how can we do that, versus hybrid models, and versus, you know, how do we transition between those? Should we have increased COVID cases? Should we find more information about the effects on children and things like that? So all of that will be coming together in the coming weeks, and it is the Ministry of Education who very rightly is leading that, and my office will be involved absolutely to provide advice and guidance that we can. I just want to go back to your other question for a second, just to say that if it is true that Vancouver's off the table, then I am disappointed, because I am a big hockey fan, but I will be happy to watch it wherever it is.
Next question is from Farhan Laji, TSN.
Thanks, Dr. Henry. Just to follow up, I mean, I know that you haven't had a chance to deal with the NHL directly, but I'm sure you've worked with them closely as far as the health plan that they've presented is concerned, and it's been reported that the biggest stumbling block was around protocols regarding positive tests within the bubble. Was there anything in there specifically that concerned you and that you just weren't willing to go any farther on?
Our advice and our direction was that if there was a positive case that arose, that we would do what we do with all cases that we have here, that we would investigate, and that there needed to be contingency in case there was other people who were identified as ill, and it might mean suspension of part of a series for a period of time until that could be done, you know, that we recognize very much that if there was a large number of people who were testing positive and had illness, that it was likely that some people's health could be at risk, that people might have more severe illness, and that there needed to be contingency built into the plan to make sure we were able to deal with that. So that's the extent of the advice or the interactions that we had around those issues. I think we need to recognize that even though most young, healthy people do very well with this virus, some people do get very ill, and we've seen that in some of the athletes who've tested positive and who've had illness in the last few months. And it can be a very serious illness for some people who may not even recognize that they have underlying conditions that make them more at risk, or for some of the people on the team who may be older as well.
Farhan, do you have a follow-up?
Yeah, just for Minister Dix, is it your understanding that this is now all off the table, or are you expecting any more discussions with either the Canucks themselves or the NHL?
Well, I think this is a decision for the NHL. I mean, I'm very proud of the Canucks. I'm very proud that they made this effort, and I just feel that here in BC, I know that the Premier, I know that Dr. Henry have been supportive of this effort. We've indicated that to the federal government. I just want to just make one small point, Farhan, when we go through the list. In Minnesota, they've had this week, not in the past, but this week, on a daily basis, between 242 and 456 cases in this week by day. In Illinois, which is another city on the list, Chicago, 715 cases. In Nevada, they had their highest day on June the 20th. That was 452 cases. In California, they had their highest day on June 23rd. That was 6,712 cases. And none of this is definitive for those jurisdictions. Of course, we're hoping for the best. And in cases of all these jurisdictions, there are people working extraordinarily hard. But we just profoundly believe that the strength of what we've said to everybody is the strength of public health here in BC, that should be a primary concern, and that's our primary concern, and that includes the athletes who come, the players, the coaches who come, the officials who come, and everyone who's taking part in the event. So we think that the efforts we've made in BC to flatten the curve are a strong reason why Vancouver is an excellent site. But we understand that people in the NHL and others have to look at a variety of criteria. But we think that Vancouver's made a strong case. And the foundation of that strong case is the health of the players and the health of the people of BC.
Next question is from Vaughn Palmer, Vancouver Sun.
Good afternoon, Dr. Henry. Thanks for taking my question. You've referred a number of times in recent days to communities that are not ready to receive visitors. Am I right in thinking that you're mostly thinking there of First Nations communities in BC? And is it your view that the government would need to negotiate or secure consent agreements from those communities before tourists could visit those places in BC?
There are a number of First Nations communities who have expressed that they are not ready to receive visitors, and that their paramount focus right now is on protecting their communities, and particularly their elders in their communities. And we are very supportive of that. I'm working closely with the First Nations Health Authority to make sure we have what they need in place, to make sure they have the testing they need. We have we've brought in the ability to have testing in First Nations communities in a rapid way. That's been a focus over the past number of months. We also have an agreement about exchanging information with communities about people who test positive, and we have plans with communities to make sure that if people do test positive, we are able to work together to support them and manage that. So those are all a primary focus of my office, and I do understand that many First Nations communities are not ready to have visitors, and I absolutely support them in those decisions. But it is not just First Nations communities. I've also heard from a number of other communities that feel that they don't have the infrastructure in place to support large numbers of people coming in at this point, and that they have concerns about transmission both in their communities, but also, things like not having the grocery stores. And though much of the supply chain has been worked out, there are some communities who are feeling particularly vulnerable still. In terms of negotiating those things, that is something that is between government and between governments, with First Nations governance and the province, and it's not my place to comment on those.
Vaughn, do you have a follow-up?
Yeah, I was just interested again because of the complexity of the province and the fact that, of course, there are tourism-dependent communities that are adjacent to First Nations communities and that overlap. Do you have any sense of, I guess, can this get sorted out, and how do you think it will be sorted out, or do you see a way clear to sort this out?
Yeah, I know there's ongoing tables where those discussions are happening. My office has been involved in some of those, and I know that those discussions are ongoing. So I expect that is the fora where these will be worked out.
Marcella Bernardo, News 1130.
Henry and Minister Dix. This question is actually for Dr. Henry regarding Holy Family Hospital in Vancouver's COVID-19 outbreak there. We know now that there are 3 people that have died there, and there are 29 residents and 8 staff with the virus testing positive. So is that now the largest outbreak in the province? Is it the main concern that you have right now as far as containing numbers there?
Yeah, it's we are obviously all of us working very hard to contain things. There have been no new cases in a number of days, which is a good thing, but we are not out of the danger period there. But I will also say Langley Lodge is another place where there was large numbers of cases, and again, no new cases for a number of days, so we are watching very carefully there. And yeah, unfortunately, all of the ongoing, the small number, the 7 ongoing active outbreaks in our healthcare system are all a worry. The good news so far is that the Mission Hospital has continued to find cases, and we're not through the first incubation period there yet, but we do not yet have any new cases in the 2 long-term care facilities, Tabor and Maple Hill, who were linked to Mission Hospital. So we are holding our breath on that one too. So all of them are a concern, and we know how devastating it can be when this virus gets into long-term care.
Marcella, do you have a follow-up?
Yes, I do. Thank you. This morning we heard from the PNE and Playland that they are planning to open up again in August, and for Playland reopening in July. What message do you think that sends to others being told that gatherings cannot exceed 50 people?
I'm not sure that they're linked, but there are provisions about how businesses can open up safely, and I know WorkSafe is providing guidance for those, as well as our team at the BC CDC. So I don't have the details of what's happening for Playland, but I expect that those guidance will be followed. So it will be small numbers. It will be with the distancing and the important measures that we know make a difference in place.
Tanya Fletcher, CBC.
Oh, hi there, Dr. Henry. I'm going back to the teacher who's now tested positive. How can you be sure no students were exposed? Also, is this not considered an outbreak since, even in a prison you consider one case an outbreak? And details on where the teacher contracted the virus. Do we know if this was connected to a cluster or is this unknown transmission? And if we could get a comment in French, please, as well. Thank you.
So we know, because this is what we do in public health. It's our case investigation, trying to link where people were exposed. And we know that this teacher was exposed through a social interaction with part of their social network. And yes, it was linked to known cases from other, as we know with this, when we have a small cluster, people have contacts, and then those contacts have contacts, and this is a contact of a known case. So we can trace back where it came from. It's not an outbreak because the exposure event for the person who tested positive was not at the school. And it was, there were no, the investigation showed that there was no exposure events at the school. So that's why we are reporting on it, because it is a teacher and the teacher was in the school setting, but there were no exposure events at the school. So it is, it's a cautionary tale. We knew that we would start to see cases when people went back to work, because as we increase our social networks and then we increase our work bubbles as well, the chances of somebody who has this connecting it just goes up, and we've seen that in a couple of places now, mostly in the Lower Mainland, but also in the interior, in the north, and here on the island.
Oui, merci beaucoup. Je veux dire que tout le monde en Colombie-Britannique, chaque personne est susceptible à la COVID-19. Donc, ce n'est pas seulement certaines personnes, mais tout le monde. Et dans ce cas, ce n'était pas un cas lié à l'école, mais à des événements sociaux dans la communauté d'une personne. C'est lié à des cas connus déjà. Donc, bien entendu, c'est le travail de la santé publique de poursuivre des renseignements sur ces questions à fond, et c'est ce que s'est passé dans ce cas. Et donc, c'est un professeur d'école, mais c'est pas directement lié à une école particulière, et pour cette raison-là, c'est pas déclaré, mais bien entendu, pour des gens qui sont dans cette position, c'est très difficile. On veut beaucoup de bien pour tout le monde. Il faut dire aussi que ça peut arriver à n'importe qui. Donc, il faut être prêt, il faut pratiquer des mesures de prudence partout. Et bien entendu, on veut tout le bien pour cette personne et pour tous les autres qui vivent maintenant avec COVID-19.
Tanya, do you have a follow-up?
Just briefly, Dr. Henry, on the you touched on it there with the contact tracing, but I wanted to ask, in light of schools, mobilizing to go up to a fuller return in September, given what your modeling showed this week about how critical that contact tracing is, you said you've been able to maintain 99% within 48 hours. How confident are you that it'll continue to be that effective in the fall when you've got more kids at more schools in more places?
Yeah, that's the big question, and much depends on what happens between now and then as well. So that's why we need to plan for contingencies. What we would love to see, of course, is full back to school for everybody, but that is one of the plans, and we also need to think about how do we ensure that we have safe distances, that we can do it in a way that minimizes the risk of having outbreaks, and whether that's cohorting in smaller numbers in classrooms and things. There's a whole bunch of things that we're looking at. I will also, and when we get the data put together, there was a good study out of the Netherlands that showed that children generally don't pass on to adults, and even rarely pass on to children. And we've had some similar data being analyzed here in BC, but when that's finalized, we'll present that as well. So our singular focus in public health is making sure that we can play our part in making sure we're as efficient and effective as possible at containing the ongoing transmission in our communities by making sure that our case management and our contact tracing and our contact management continues to be effective. So that's going to be a really important part. If we start to see a whole lot more cases as we're going into September, hopefully we won't if we keep doing what we're doing, but that will be one of the considerations about how it looks going back to school in September.
Next question is from Moira Warburton, Reuters.
Hi, Dr. Henry. I'm just wondering if there are any circumstances where BC workers who test positive for COVID-19 but are asymptomatic are allowed to return to their workplaces?
Yeah, for the most part, we don't. We have had some occasions earlier on, in particular, where we had healthcare workers who had very mild illness or were asymptomatic and were positive, and where there was a critical need. They could, in some cases, with the appropriate personal protective equipment and other measures in place, return to work. But no. It just invites, we know that in that pre-symptomatic period, asymptomatic period, there can be shedding of virus, and it can be quite high for some people, and we can't tell ahead of time which person's going to shed a whole lot of virus. So definitely what we want people to do, even if they're asymptomatic, is they need to isolate for a period of time.
Moira, do you have a follow-up?
Yeah, I'm just wondering what you think of Ontario's approach of allowing critical workers who do test positive but are asymptomatic to return to work under some precautions.
Yeah, and so that is in keeping with some of the measures that we've had in place as well, when there are critical shortages and people who can only do a certain job who are asymptomatic with appropriate precautions in place, but that's been very rare.
Next question is from Penny Daflos, CTV.
Hi there. Thank you so much for taking my call. I just wanted to go back to the NHL issue, and I'm just wondering, when it came down to discussions with the NHL, I know you may not have been directly involved, Dr. Henry, but I'm just wondering, what did they try to negotiate on, and were you able to make any concessions for them, or was it that your position was unflinching and unmoving as far as you were concerned?
The only thing that I am unflinching and unmoving on is that the primary concern that I have is the health of the population of British Columbia and the health of anybody who's coming into this province. And so the discussions with the NHL were between the Canucks franchise and the NHL. I'm not privy to the details of that.
Do you have a follow-up, Penny?
I do, yeah, and I'm just, I think some people are just a little bit confused as to why our expectations health-wise may be different from other provinces and why that makes them more attractive. And I'm just wondering, is it, debate within the medical community about the best way to move forward? Do you think these are political considerations being made? I think people just want to try to understand why the advice here is different from, say, what it would be in Nevada or Ontario or Alberta.
I don't believe the advice is any different. It is pure speculation that that is the reason why the NHL, if they even have, has ruled out Vancouver. So I think there's a lot out there in the media. I don't know what those discussions were. I've not been told. We all have the very same, at least here in Canada, I know from my colleagues, we have the same approach. I have been very supportive of the NHL approach and the plan that the Canucks put together. I think one of the strengths that we have is the fact that we've worked very closely with the public health focus and with the health of both the population here in BC, but the health of the players and the teams that would be coming as well. So I think it is speculation that that is the reason why, if even Vancouver is off the table. I don't know if you want to talk to that.
Say that the Vancouver Canucks presented their plan. It was reviewed by Dr. Henry and then submitted. The federal government asked for the opinion of the provincial health officer and of the government, and they received it. Obviously, it's up to the NHL to make its own decisions and to decide what's important for the NHL and what isn't from a commercial and health basis. But I just repeat that they may have made a decision, they may not have made a decision, but the evidence is that the focus on public health issues here in British Columbia, led by Dr. Henry, has been exceptional. And I think that's an argument for them to come. And I think they probably received that as an argument to come, but presumably they have many commercial and other reasons that they consider in addition to that. But if I was involved in the NHLPA or I was involved in the NHL, I would see Vancouver as an exceptionally attractive place to come, not because we would bend on health issues, but because we have a strong public health focus here.
Lisa Yusta, News 1130.
Hi, this is for Dr. Henry. With more allowance for people to meet other people, preferably at a distance in phase 3, for those who are not in relationships, those who want to bridge the distance, shall we say, how do they go safely about getting some sub 11 when social distance is too much distance? How do they make decisions on this?
Oh dear, these are the kissing questions again, right? I don't know. I think there's lots of things that we need to take into account, and it really depends on our own personal circumstances. So yeah, go outside, meet outside, decide whether this is somebody that you want to include into your bubble, into your space, and be wary yourself of understanding that your connections you're going to bring home. So it depends. If you're somebody who's single and doesn't have a lot of other people who may be at risk that you're having contact with, then you can think about this in a different way perhaps. But I think this is the time. We can't stop it being summer, and love still happens in the time of COVID. So I think people need to make their own decisions based on what their own risk is and the risk of those that are closest to. So this is a time to start online, start meeting outside before you take the plunge.
Do you have a follow-up, Lisa?
I'm good, thank you.
Thank you. Sorry. Last question today. We have one more. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Keith Baldry, Global News.
Hi, Dr. Henry, Minister Dix. Thanks for taking my question. BC's policy for temporary foreign workers differs than other jurisdictions, and we've seen success with that, with putting them immediately into quarantine. Today, the Agriculture Ministry released new rules for fruit pickers coming in from the rest of Canada, where they have to get a certificate of approval or show they've got COVID knowledge and present it to a farm before they get employment. Given that many of them are coming from provinces that have much higher COVID numbers than BC, do you think that's enough to placate or allay some of the concerns that may be in local communities in the Okanagan?
Yeah, this is an issue that's been going on for some time. First I will say yes, we have had, since we had one outbreak early on, as you will recall in a nursery in the interior, we have put up all of the temporary foreign workers who've come in into hotels in the Lower Mainland and made sure that they had what they need so they could successfully quarantine, and that has kept us in good stead. A number of the cases that we've had in the last few months, I think we're up to 28 people who have come in from the temporary foreign worker group who have tested positive for COVID-19 while in quarantine. So, those are potential outbreaks that could have happened on farms. Even the best of farms, the accommodation could be challenging to keep people safely quarantined. So it has been very effective for us, and I think it's a very important piece of how we have managed this, both to support the workers so that they get the care that they need, but also to protect our communities. And I know they announced the creation of camping areas, and this is an ongoing issue with domestic farm workers who come in often from Quebec in the summers, mostly in the Okanagan, and often to pick fruit and places like that. So I understand that there's been agreements to have them, to enable them to use some of the campsites in those areas, and that they have appropriate hygiene and other things in place. So this whole certificate is making sure that everybody is aware of what they need to do. And of course, we don't stop anybody coming in unless they're coming from a direct outbreak themselves. We want them to self-monitor. We want them to be aware. So I think this is a very important step to help support those needed workers here in the province this summer. And I hope it will be effective as well.
Keith, do you have a follow-up?
Oh, that's good. Thank you.
Thank you. That's all the time we have. Thank you.